So, tell us about yourself. Where do you belong from? Which college have you studied?
Yes, ma'am. I have done my MBBS from IGMC Nagpur and I've done my MD from GMC Aurangabad. So, ma'am, my exams were in December. And then in the first week, I had my theory. In the third week, I gave my practicals. And in the final week, I had the NEET SS. So, it aligned really well. So, yes, ma'am.
So, how is your college? How is GMC Aurangabad otherwise?
Ma'am, we do have a lot of patients because it is the only tertiary care center in a very big area, large part of Maharashtra, which is called as Marathwada. So it has a lot of patients. We have a lot of variety. Plus, we do have a lot of machines which are working all the time. And we have multiple MRI machines as well as we have cancer exposure. So, ma'am, it works really well for the variety of patients as well as the machines are always working, which is a important part for radiology, I feel. So, ma'am, there's always scope to learn there. So,
So,
ma'am, that is
you have all the modalities, right?
yes, ma'am. All modalities are functional.
Okay. And you have
Yes.
IR also?
Ma'am, we don't have a functional cath lab as of now. But yes, yes, ma'am.
So, any of the faculties who is like an IR DM or anybody who has.
Yes, ma'am. We do have faculties, but ma'am, currently we do not have a functioning cath lab. So I have approached them about this, how to proceed ahead, and should I be going into a 3-year DM or a super specialization? And I was trying to gather all the information about this from them.
So, in the first year when you moved in, you must have been just like any other resident, right?
Yes, yes,
You
ma'am.
overwhelmed, right?
Yes, ma'am.
Just trying to get through the blacks and whites of radiology, right?
Yes, ma'am. Yes, ma'am.
And did you actually thought that now, yes, I have to prepare for DM? When
No,
did
ma'am.
you thought?
I had no clue because I am the first in my home as a doctor. I don't have any background. So, ma'am, everything was in the process. I learned everything in the process. I get to know, I get to, there was no first hand information. I had to acquire information in order to take a decision. So, radiology itself, because a lot of people don't have any introduction to radiology in their MBBS years. So, ma'am, even to pursue radiology, I had to gather a lot of information, and somehow I have chosen this stream. And now, to ma'am, if I have to go ahead or not, again I'm trying to gather information. So, ma'am, it was not at all planned. I felt I have taken radiology like most of us have because it's a end branch, so it is like it's a comfortable end branch. So I am not pretty really sure about the DM part of it.
You end up giving the super speciality
Yes, ma'am,
exam,
but I
right?
did give the exam because I wanted to keep the flexibility, the options. And in the first place, I did not feel that I'll be getting a decent rank. So, yeah.
So you did not do anything special for the exam, or did you do something special, some special preparation for the exam?
Ma'am, the preparation for super specialization, as of no, ma'am, nothing in particular, but I did follow everything on e-conceptual, all the videos, everything. Like I followed Zainab ma'am's videos, Nikita ma'am's videos, also Shashank sir's videos. A lot of them covered everything, all the basic aspects. So, ma'am, I felt the exam was primarily what we had learned through in the 3 years of a residency. It was nothing different. There was nothing different except for the biostats part, which we were not aware of. Other than that, ma'am, whatever we have learned in 3 years, I felt they were testing those skills only.
Okay. So
Yes,
what's
ma'am.
the pattern of exam? Would you just like to tell a little bit about how the exam is, how many questions are there? How
Yes, ma'am.
for it? Do you
Ma'am, we had 150 questions, and they were in the sets of they were in 3 sets of 50 questions each. And
right?
ma'am, there was the timer was set for each set, so we cannot review the set once the time is over for that particular set. But
Okay.
we can review it once the time is still on. So,
Okay.
ma'am, we cannot move to the next set even if we are done with the first set. So that was different from NEET PG, I feel, because we could just jumble between questions in NEET PG. We could just review any question. But, ma'am, here it was set wise and the time was fixed for each set. So, ma'am, it was there was sufficient time actually. There was no problem with it. But, ma'am, we had 3 sets, so that is the different part that the time was allotted for each part differently.
Okay. So it's like
Hmm.
60 minutes. It's a overall 3 hours and 50
Yes, ma'am.
questions,
Yes,
right?
ma'am. 50 questions each set.
And the sections are divided. Like first section is so and so parts will be covered. The second and the third.
Ma'am, I'm not aware, but I did not feel that there was any segregation. Everything was integrated. It did not feel like a section. It was pretty integrated.
So when you fill up the exam, so
Hmm.
for the rest of the residents, when you fill up the exam, you have to choose the super specialty that you are going to pursue.
Yes, ma'am.
Special questions for that super specialty that you pursue, does that carries like a 50% weightage and the rest carries 50%, or is it all the same?
Ma'am, like I had chosen just radiology. So, ma'am, the whole bunch was just radiology questions. And only some questions were from biostats, which I was not aware of is a part of the exam.
Okay. So what are
Yes,
the
ma'am.
branches of super specialization? What all branches are included as of now?
Ma'am, as of now, we have neuroradiology, which covers intervention as well as diagnostics, part of neuroradiology. And then we also have intervention radiology, which is the main chunk for what people are giving this exam primarily. And people are aiming to get intervention radiology. Those who are passionate and are sure, they are definitely giving this exam for intervention radiology. And we also have cardiovascular and thoracic, ma'am, but like I have not seen a lot of places have that as a DM option.
So majorly it is IR
And neuroradiology, yes, ma'am.
and maybe some part of the cardiothoracic, whomsoever wants.
Yes, ma'am. Yes, ma'am.
Okay, so if we have to sum it up, for the diagnostic people, still we do not have a DM.
Yes, ma'am. There is no specific DM as of now.
Primarily interventional.
Yes, ma'am.
So what is your thought? What are you gonna opt for?
Ma'am, whatever little information I've gathered, I feel whatever my seniors and my professors have advised that if I opt for intervention, if I narrow down to intervention, I won't be able to practice the diagnostic aspect of radiology. So I'll have to give it up completely. And for that, I'm not sure if I want to give it up as of now, because that is what I've been doing for the 3 years of my residency. So, ma'am, something that I worked on, I feel I cannot leave it so soon. So, I'm trying to figure out the other things. Although there is also a big learning curve to it, ma'am. 3 years itself, like we have to give 3 years of our time. Plus, it comes with a bond, and then also there's going to be a learning curve and the practical parts of it that you need a cath lab, you need a setup.
Yeah.
So I'll have to figure out if I want to go in that direction, if I want to be associated with hospitals in metro cities which have this facility, or do I just want to like do I need to narrow down that much, or do I want to keep the flexibility of being a diagnostician? So ma'am, that question I'm still wondering on.
So you're still wondering whether you want to,
Yes, ma'am. I'm just trying to acquire whatever information I can and then come to a conclusion.
and what if not? What if you do not opt for this? What else are you gonna plan for?
Ma'am, the next step that most of my seniors have given the FRCR. So, ma'am, that gives us the flexibility also if we want to move outside India, because, ma'am, USMLE is out of the box now. We have that boat has sailed. So somehow we have to, if we want to keep the flexibility, then, ma'am, FRCR definitely is on the cards, and DNB exams, ma'am, even that in my SRship, I would like to give these two exams.
Right.
And also some fellowship. A lot of people are focusing on fellowship, so if I can narrow down to some fellowship that I feel I might need to refine my skills, or I want to narrow down to that particular area of interest, so ma'am, that is there on the cards, but I don't know which one yet.
Yeah. It's too early. You just have given exams in December.
Yes, ma'am. Yeah.
So yes, you're gonna take your own sweet time.
Yes, ma'am.
Also, how would you like suggest rest of the people, rest of the residents who are watching you, how to use the resources that are available? Like CR has now got a huge resource, right?
Yes, ma'am. Yes, ma'am. Everything is there.
You able to
uh,
everything, or how would you tell them how to approach topic wise, system
hmm,
wise, or maybe
hmm,
what you see every day in that?
hmm.
What is the best way?
Ma'am, in residency, I whatever in the 3 years I have realized over the 3 years is that we start off fresh in first year in the hope of learning a lot. Like we want to learn, we want to gather a lot of information, we want to learn, but then over time it becomes like work. It
Right.
becomes a little monotonous, and we learning takes a backseat. So we have to focus on the learning actively, we have to do it on our own, and no one's going to come and tell you. So we need to do it on our own. So ma'am, third year is when we kind of wake up and okay, now we need to figure this out. So ma'am, on conceptual radiology, I felt that everything is very sorted, everything is properly given. Even for my theory exams, I prefer to the DNB Q&As. I refer to them because those are the bunch of questions that are standard for even our MD theory exams. So, ma'am, they had a lot of tables and flow charts, which are very easy to write, because when you're writing a theory exam paper, you cannot expect to write a lot of pages because you don't have enough time. So,
Right.
ma'am, the flow charts and the tables really came handy, and the diagrams that they're given in the DNB Q&A really helped. So, those were my key points for the theory exams. And ma'am, I tried to just narrow down my source. I tried to build on my notes, but I made sure that I only had one source. Even if I'm reading some other book or any standard book or any other book or any other notes, I made sure that I compile it in such a way that when I have to revise a day before the exam, I have something in my hand that I can revise in a day or two. So,
So
ma'am,
are you
that I made
a
sure.
person or are you a separate notes person? Like we all end up doing either it in the books or a separate notes. This is also a confusion for all of the
Yes,
residents,
yes.
right?
Ma'am, the thing with residency is I figured that we cannot make our own notes. We don't have the time. Plus, the material is very big. Like you need to learn a lot of things. It is not practical to write your notes, but you can always build on it. So, ma'am, I made conceptual as my base, and I added whatever I needed to add on it. Or I added whatever I felt like this particular point needs to be there, or I need to make my own flowchart. So, ma'am, I just added and builded on it. So, ma'am, I just had a good framework already with me because of conceptual. I had the notes, I watched the videos as well, and I felt if there was a need, I just kept on adding and compiling in that one book so that everything is in one place.
So regarding the physics part, so did you?
Yes, ma'am.
What would you say? I mean, having physics started, most of us do. We rush to physics in the last time, right? In the
Yes, yes, ma'am. Yes, ma'am.
and it is
Yes,
also
ma'am.
a problem.
Yes, ma'am. So, ma'am, a lot of my seniors had suggested that I read physics in the first year itself so that you do have a base, so that it doesn't come as a surprise in the final year. But the workload was so much in first year, I failed to even start a page. So, ma'am, somehow in my second year, I started reading MRI, but even that failed. I did not complete anything. But ma'am, the videos that Nikita ma'am has on the platform, it does give a very good overview. So we have a good base that we can build on. Also, Zainab ma'am has certain videos. So ma'am, the base is there. So we just have to build it on. So ma'am, there is a lot of overview. A lot of topics are there which are covered, but there is just an overview. We need to build on it. So ma'am, I
Watching,
feel on
right?
yes, ma'am.
Watching a video makes it easy. Then
Yes, yes, ma'am. It does make it easy because if you just read it, it becomes a little difficult. It's difficult to understand it in the first go. So if someone is explaining it to you, it becomes easier. Physics, ma'am, because we are going to read physics after a long time. I mean, we read physics when we were giving our NEET UG exams entrances. So it has been some time that we have read physics. So ma'am, we have lost touch. So I feel that videos make it really easy, and the notes are concise as well. So it helps us, ma'am. How much we need to know is more important.
maybe for the physics part, we can start as early as first, not
Yes, ma'am.
earlier, then at least second year, and
Yes, ma'am. Definitely as early as possible.
specialty you're doing, like you start with ultrasound, maybe read that physics,
Yes, yes, ma'am. Yes,
that physics. So going with the modalities, the physics makes it easy, right?
yes, ma'am. Yes, definitely.
Perfect. So ultimate question for the
Yes,
people
ma'am.
who are taking radiology is that will AI replace the radiologist?
Yes, ma'am. For this, I feel in India, the scenario right now is even if you replace humans with machines, you have to sign the report. Like people are not going to believe on a machine. I feel if someone is generating a report, it's very difficult to, kind of like it has to be reviewed by a person. Like I feel in India, the doctor patient relation is such that they will always rely on a human being. They would want a doctor to, go through it. Ma'am, there have been multiple instances where machines have replaced, but we have to verify. Plus, the ethical aspect of it is also there, which we have not, which has not been, there's no clarity on the ethical aspect of it. So, ma'am, I feel in the next decade or so, there's not going to be a lot of change. But after that, we can't say much.
So yes, definitely, even a robot is being operated by a human to operate.
Yes, ma'am. Yes, ma'am. That is happening. But I feel in India, there is some sort of hesitation that people have. People will still believe a human. People will still believe in a doctor. That's what I feel. The shift will take some time. Yeah.
So the NEET PG aspirants do not need to worry. They can very carelessly and very smartly take up radiology.
Yes, ma'am.
Machines are here to help rather than to scare us, and we cannot be replaced.
Yes.
Right?
Yes, ma'am. Yes, ma'am. Definitely.
Engage for that. So many congratulations, Dr. Rigveda, for
Thank you. Thank you so much, ma'am.
insightful. We are so happy that you have been associated with us and you are so hardworking. We wish you all the best for your future, and we wish our association continues forever.
Thank you. Thank you, ma'am.